from a health doctor's point of view, physical activity is really the closest we come to a panacea. It's good for everything, for your heart, your lungs, your legs, your muscles, your brain, your mind, and nothing else quite matches it. And as people often point out, if it was a drug, we would be promoting it to the heavens. And I spend time on the tube, although I cycle mostly in London, but when I'm on the tube, I'm always horrified by the number of people that just stand on the escalators. And I feel like shouting out to them, don't you realize if you were to walk, you might well live longer and you'd feel better. So we've got 3 speakers. I'll introduce each of them as they come to speak. And then we'll have questions and comments. The whole thing is being recorded, so if you don't want anybody to know you're here, you better disappear or change your name or something. And please put your questions into the chat, but I think we'll be able to get you to ask them, but I'll ask them for you if you don't want to speak. Right, let's kick off then. So we're going to hear first from Chris Billington. He's a public health strategist at the Association of Directors of Public Health for London. He supports the Directors of Public Health in London's 32 boroughs and the city to improve and protect the health of their population. He manages the London Climate and Health Network, which includes a focus on encouraging active travel. He's also worked at Transport for London, Public Health England and Sustrans, where a key aim of his work has always been to increase levels of active travel to benefit planetary and public health. So he's going to be talking about active travel to achieve net zero NHS. Chris, over to you.
Great, thank you. I'm just going to share my screen. I'm going to share my entire screen. So I think the window wasn't working properly. Hopefully you can all see that. We see that? Yep. Brilliant. Okay. So thanks very much for that introduction. It's really nice to be here today presenting alongside Adrian and Andy, because Adrian gave a presentation when I was doing my MSc in public health and physical activity, which sort of helped inspire me to get into this space. And then I worked under Andy at Sustrans as well, which was great. So in terms of what I'm going to be talking about today, we'll be doing some work in London on encouraging active travel through the NHS for better planetary and public health. So that's sort of the main focus of today. This was mainly work that I was doing when I was at TfL, but I'm still involved now. And today I'm really sort of presenting on behalf of these partners at the bottom here. Oh, I don't know what's going on there. Sorry. Let me just do this again. Sorry, I'm not used to using this this one. So there we go. Oh, how do I go? Next slide then. Sharing the screen. Yeah. Right, hopefully there we go. Sorry about that. All right, there we go. So in terms of the aim of today, we have this work in London to increase the proportion of NHS staff and patients achieving 20 minutes of active travel a day, which broadly makes up the 150 minutes a week that we should be doing under the sort of chief medical officer's guidelines, in part to improve public health and partly to improve, planetary health as well. So I'm going to talk about the London policy context briefly, then I'm going to make the case for active travel, hopefully, and then I'm going to talk about, things that the NHS can be doing to increase active travel. Oh, God, I don't know what's going on here, I'm jumping about a bit. Anyway, there we go. So in terms of benefits of encouraging active transport, public health, which I'll talk a little bit more detail about in the next slide. Environment, we can see here in this chart that transport is the largest emitting sector of greenhouse gas emissions, so it's an obvious target. In terms of accessibility inclusion, it's really important that we create accessible environments moving forward as we move towards an aging population as well. It's really important that car dominated environments can be difficult to navigate making it difficult to cross the road and things like that. In terms of the economy, we know congestion costs the UK economy billions, and we also know that promoting active travel can, boost local economies and local businesses as well as hopefully reducing spending on the detrimental impacts of climate change and preventable disease as well. So this banner in green at the bottom just shows that in 2021, around 49% of trips in towns and cities in England were under 5 miles, with around a quarter of all trips in England less than 2 miles, demonstrating the potential for feasible change. Obviously, not all car trips can be switched, but a huge proportion can be, particularly in London. So when we think about the impacts of motorised road transport and health, tend to think about them in these sort of 6 ways. Today, I'm going to mainly focus on air quality and physical activity, just because I don't have a huge amount of time, but it's worth noting that there are broad range. So if you look at the top 15 risk factors for death in London, you can see that tobacco is at the top, no surprises there. But then all these ones highlighted in green are strongly associated with physical activity, strongly influenced by physical activity, high blood pressure, type 2 diabetes, obesity. They're all mediated by physical activity. And as Richard was saying earlier, if physical activity was a drug, we'd all be taking it due to the kind of diverse range of impacts it has and the large impacts it has on a range of chronic diseases. So in terms of physical activity and how many people are meeting the Chief Medical Officer's physical activity guidelines, we've got a nice recent chart here. And we see that a third of adults in England do not achieve minimum Chief Medical Officer physical activity guidelines. And what's kind of very concerning about that is that there's large inequalities and they're growing, and they have been for some time as well. So that will be driving health inequalities. So active travel is the main source of physical activity in the UK. We know active travel, walking, cycling is popular, familiar, can be sustained across the life course. And can be social and integrated into the everyday routine, so it ticks a lot of boxes. Here we see some analysis, underneath on sort of some work we did in London, looking at the impacts of getting everyone to do 20 minutes of active travel a day in London. So active travel is an equitable type of physical activity. We can see here that actually the least deprived and most deprived are really closely aligned, and there's much smaller gaps in active travel differences across socioeconomic groups than there is general physical activity, which we saw before. So this is a chart that I really like, that I pulled together when I was at Transport for London, looking at the amount of physical activity you get associated with a typical trip across different modes. So sort of key take home here from this is that public transport also counts as active travel, because you're going to, you need to walk to the bus station, or you need to cycle to the train station as well. So it's important that we consider that moving forward. Also, in terms of air quality, despite recent improvements in London, toxic air pollution is still the biggest environmental risk factor to the health of all London, as you can see what road transport accounts for there. There's some analysis done in 2019 to show that toxic air contributed to around 4,000 premature deaths, showing the kind of scale of that. And you can see the cost to the NHS on the right-hand side there as well. In terms of air quality and health inequalities as well, it's really important to acknowledge that air quality affects everyone, but it's also health inequalities issues. So we know that vulnerable communities and people with underlying health conditions are disproportionately impacted by poor air quality. So communities with high levels of deprivation, or a proportion of people from a non-white ethnic background, are more likely to be exposed to high levels of air pollution in London. And we also know that, every hospital and medical centre in London is located in areas which do not meet World Health Organization guideline limits for toxic air pollution. Hospitals are places that we go to get better, so it's not ideal that they're not meeting the WHO guidelines. So that's a bit about the case making in terms of how can the NHS increase active travel. Well, we thought about it across these kind of 4 domains, really. Obviously, some of them interact, but we found it's quite a useful way to think about it. So starting with NHS policy, the NHS is currently embedding active travel in relevant policies and strategies. I think a key sort of update here is that the new net zero travel and transport strategy, which will guide future NHS green plans, which are currently in place and have active travel sessions, is currently in development. And, that will provide more information to people, in a sort of overarching strategy on what they should be prioritizing, which they can adapt for a local, context. So in terms of regional travel and transport deliverables as well, we've got some here that hot off the press, still in draft, but likely to be agreed soon. Increased collaboration with local authorities and their initiatives. So it's really important that NHS sustainability leads work with their local authorities to try and sort of complement existing strategies to, look at changing, for example, travel infrastructure around a hospital. Those conversations need to be had with the local authorities. Low emission fleets, obviously less of an active travel one, more of an air quality one, but still really important. Staff travel surveys, these are going to be really important in understanding your local, population. How are people, how staff and patients getting to the hospital, knowing that sort of information is really useful to know what kind of interventions you want to put in place to try and increase the levels of sustainable travel. And then salary sacrifice. So this is, I've used this scheme in the past. It's a really good way of, spreading the cost of buying a new bike, and also making some savings on tax as well. So those are the kind of main ones. And then modal shift as well, just ensuring that we are shifting away from private vehicle usage to more sustainable modes as well. So in terms of creating healthy and sustainable environments, I talked about that a little bit. It's important that NHS works with local authorities. We've got a bit of a graphic here talking about the kind of things you can do to make it more easier for people to travel sustainably to a hospital, whether that's putting a new bus route in place. It might be making the walking infrastructure more attractive, or putting a cycle route in, or cycle parking in, for example. And that kind of underpins the work we do in London, the Healthy Streets approach, which is looking at making sure that we are, we know our behaviours, determined by our environment. So we've got to make the environment amenable to, sustainable transport. So there's a nice case study here from North Middlesex Hospital cycle route. So Enfield Council is in the process of delivering an active travel route that is funded by the DFT, which local authorities are able to, apply for, and that will make it, more easier for local residents to walk and cycle to that hospital. So in terms of NHS patients, what can we be doing with those? Well, it's really important to consider that healthcare professionals are a really influential group. People listen to what they say. 1 in 4 say they would be more active if it was recommended by a healthcare professional when the survey was conducted. There's a number of opportunities to further promote active travel within the NHS. So, we've got OHID's Moving Healthcare Professional Programme, Physical Activity Clinical Champions, which I'll talk a little bit more about on the next slide, NHS Health Checks, and, also looking at undergraduate curriculum. So I delivered with some colleagues at Imperial a workshop on the benefits of, the health benefits of active travel to some medical students. And following that 95% report, they were going to be more likely to promote active travel to patients in the future. We made sure we'd sort of chip them through some challenging questions so that, they'd be able to have conversations and have kind of things to come back with that, people might bring up. Worth noting this, the Greater London Authority, GLA, produced a toolkit to help healthcare staff encourage more walking and cycling, so that could be useful to people moving forward. So also thought to flag this, some work we produced during my time at TfL, so asking inactive people to do 20 minutes of active travel per day. We ran a research project looking at, can we feasibly change behaviour, and we've got some really good evidence coming out of that. And it's summarised here, so you can access that after the session. But in terms of key findings, found that exercise was perceived as something patients had to make time for, such as going to the gym in the evening, and obviously that could act as a barrier. But participants found that the 20-minute per day active travel challenge was an accessible and enjoyable way of achieving physical activity recommendations. So there's a nice quote here. Why did it never occur to me that exercise could be walking as part of the journey? So one participant was told by their doctor they needed to do, half an hour's walking a day. So they tried to start doing it in the evenings at their local park, but we're finding it difficult to, find the time and the motivation. Once sort of, talk about reframing that as something that can be done as part of their commute to work and back, getting off a stop earlier, they found it was much more achievable to integrate it that way. So in terms of NHS staff as well, it's really important, NHS staff can act as role models, in this active travel space. It's really important that we, role models and advocates as well, so it's really important we highlight the benefits of building active travel into the everyday routine to health professionals. There's a number of promotion of offers we can consider. For example, in London, NHS staff get 50% discount on annual Santander cycle hire membership. So obviously that's a very London-centric scheme, but there are cycle hire schemes in other towns and cities across the UK as well, where similar things could be done. And providing information on maps and wayfinding apps and routes can be really useful. If you've driven to work for the past 10 years, it can be quite hard changing your behavior. Information is going to help that nudge you into new ways of traveling. So that's really, can be really useful. Knowing about a new local bus route or a new cycle path in the area might just nudge people into changing their behavior. And then also advocating for active travel hubs at healthcare centres. Really important that we break down the barriers. Providing cycle parking. You might not want to take your expensive bike if you don't have anywhere safe to park it. And availability of showers and lockers, etc., is also really important to people. So in terms of this case study here, we did some work a while back making sure that active travel was included in the physical activity clinical champions training pack. So that was a really good outcome for us to get that embedded in that training pack, so that anyone who gets trained up to be a physical activity clinical champion as well now will have that knowledge of active travel and that focus on it. And then also just a case study from Central London Community Trust. They did implementation of e-bikes. E-bikes can be a great way getting inactive people more physically active, sort of act as a stepping stone back into cycling perhaps. And there's also evidence to show that people who use e-bikes actually do accumulate physical activity whilst doing it. It raises their heart rate. Because you could criticize it saying, well, they're not going to get any exercise. Well, but there is evidence to show that they do still accumulate physical activity. Some good research from the University of Bristol on using e-bikes with populations who have got type 2 diabetes, actually, which is some good research from them. But in this instance, in terms of staff using them, 62 one-month e-bike loans were completed. 90% of staff rated the trial very good or excellent. Participants said they either saved money, found cycling an easy way to fit exercise into their everyday routine, sort of tying in with what I previously mentioned, and then felt improved mental health and well-being, saved time commuting or traveling to appointments at work as well. And then there's a sort of nice quote there, particularly the bit around really enjoyed the experience, and it's prompted me to invest in a regular bike. So it's kind of acted as a stepping stone in that incident. So in terms of key take-home messages, I think the tech issues threw me off a bit at the start. I think I might have breezed over some of the slides a bit. Anyway, there we go. Transport is the largest contributor to greenhouse gas emissions in the United Kingdom. Physical inactivity and poor air quality is leading to premature deaths. Active travel can help tackle air pollution and represents an equitable form of physical activity that can be built into the everyday routine. Encouraging everyone to do just 20 minutes of active travel per day would have huge health benefits and help to reduce pressure on the NHS. The NHS can help to boost active travel through influencing and delivering relevant NHS policy, becoming advocates for healthy and sustainable environments, and promoting behaviour change amongst staff and patients. And that's me done. Thank you very much.
Good. Thank you very much, Chris. I'm sorry that we can't applaud you, but I suppose you're probably getting used to that on Zoom presentations. I was intrigued by you pointing out that many people somehow associate physical activity with going to the gym, sort of failing to recognize that just walking during the day, going to catch the bus is that's the way that most people get most of their exercise. So I'd urge you to put your questions into the chat. Otherwise what tends to happen is you forget the questions for Chris and they're all concentrated on Adrian. Right, now we're going to hear from Andy Cope, So Andy's the Director of Evidence and Insight at Sustrans. His expertise is in research, evaluation and monitoring of active travel. He focuses on getting best value from the evidence about the effectiveness of the work that Sustrans and others deliver in support of walking and cycling. His key skill is his ability to translate research and data into evidence of the benefits of walking and cycling to support development and policy and practice. And he's going to be talking about active travel for healthy aging and reducing inequalities amidst the ongoing climate crisis. Over to you, Andy.
Thanks, Richard. I am going to present something. If I can only work out how to show my window. I don't seem to have all the windows that I've got open.
Right.
Yeah, mine disappeared annoyingly when I came to present it, so I had to just share my screen in the end.
What I'm going to do, I'm going to close a couple of superfluous windows. I'm ever so sorry about this. Do bear with me.
No, don't worry about it. So you do know it's that little box with the arrow?
Yes, no, I've got that. It's not showing my
the
okay, I'll do what Chris said. You said share my entire screen. That's I'm going to share my entire screen and then go into PowerPoint and stick that on there. Is that okay? Can you see that? You should be able to see a big blue slide.
Yeah, we can see that.
Okay. Sorry, that feels a slightly clumsy way of doing it, but I hope this works for now. Thank you for the invitation to talk today. I'm never quite sure how much of an introduction Sustrans needs, but just for the sake of you who aren't familiar with Sustrans, we're a walking and cycling charity. Our aim is to make walking and cycling easier for everybody. We've got two strategic priorities. One of them is livable cities and towns for everyone, and one of them is paths for everyone. And the for everyone bit is really crucial to the work that we do. It's not by accident that they're tagged onto the end of those strategic priorities. What we're trying to achieve is a kind of an equitable enablement of people to walk and cycle. So making sure that what we deliver, what our partners deliver, what happens in active travel works for everyone, rather than just specific groups. So what I'm planning to present on today is a specific project about aging better, a piece of work that, in fact, Adrian, who's your next speaker, did a lot of the work for. It was on a commission from the Centre for Aging Better. The Centre for Aging Better defines midlife as aged 50 to 70 years. So you can make of that what you will. That's the parameter that they set for us. That actually worked really well in the context of this study. The climate crisis, just before I get too much into the better aging work, there are so many different themes under the climate crisis now. I'm sure I don't need to explain them all to you, but some of the ones that are particularly big on the Sustrans radar, with Chris having set that context of saying that transport is the biggest contributor still to carbon emissions. It's those issues of displacing car trips, that question of traffic demand management, these issues that we're seeing at the moment of minority opposition to low traffic neighbourhoods, the move to bigger cars, the stats on the number of people that are buying SUV type vehicles is truly terrifying. Issues of transport poverty and the cost of living crisis, things about micromobility and future transport and the directions that transport is moving in. Roads investment, of course, the way that government is still investing into city roads, and recent funding cuts in active travel as well. Some of you I know are aware of the issues that we've got going on there. That central government has cut funding in recent weeks to active travel. I'm not really going to talk about any of those themes, but they're all themes that really play into the kind of work that Sustrans is trying to do, and they're playing particularly to the way that we're trying to work with everyone, with all these different groups. This particular presentation is just focusing in on better aging. So the aims of the project were to, as it says on the screen, to understand better how people in midlife can be supported to take up active travel or to maintain or increase their levels of active travel. So there are two elements to the study. The first being an evidence review, and the second some primary evidence gathering. The first stage, which actually Adrian did most of the work on, or a big chunk of the work on, focused on two key aspects: attitudes to the environment, the role of the built environment as well, and just trying to understand what's available in the literature, what the literature is telling us about these facets. Suffice to say, there isn't that much literature, or not as much as we'd expected, I think, going into the study. What we were able to distill from the available literature was a series of motivators and enablers, and then a series of barriers. I'll just run you quickly through these. I don't think any of these will surprise you necessarily, but it's what the evidence is kind of telling us. So motivators and enablers, the health benefits of physical activity, again, exactly what Chris has been talking about, the mental health benefits in terms of relaxation and stress reduction, enjoyment of the outdoors, that sensation of being outside and being able to be active in the open air. Feeling independent and in control is a really important factor as well. And people thinking about preparing for an active retirement, which is gratifying in the context of this study. But changes in personal circumstances, such as moving home or changes in employment, those kind of points of transition, which is a theme that we'll come back to actually. And the barriers, distances that people need to travel might be too great in rural areas. I'm sure we can all understand that. A lack of motivation, a lack of priority. Where does active travel fit in your sort of daily regime of activity? The weather, of course, we're often put off by the weather. I'm in my chilly loft in Northumberland this afternoon, where it's raining and very, very cold, and does tend to make people a little bit reluctant sometimes to go out and do walking and cycling. Personal safety or feeling unsafe, the lack of an active travel habit, and can't you see what that one said? Oh, declining health or disability is the other factor down there. So all of this lurking there in the literature. So, I mean, just bringing that together, I mean, the key finding from that was the paucity of evidence, the lack of evidence that we got in relation to this age group, and the need for more specific research. The classic finding of any research project, the need for more research. We try and avoid that where we can, but it was particularly pronounced in this example. And the lack of evidence on differential attitudes and impact of the environment on specific population groups. So this kind of questions of intersectionality and different bits of the population, and how we treat, how we understand people with differing needs and different approaches, different life stages, I suppose. The second part of the study was some primary evidence data collection. This is just a methodological note. I won't go through that. Suffice to say, there was some methodology. We spoke to quite a lot of people to try and get this material. And where it brought us to is that we've got 10 key insights and kind of policy implications that emerge from the study, that are our recommendations, not just to the Centre for Ageing Better, but for the whole narrative that the Centre for Ageing Better and ourselves and our partners want to set up and talk about in terms of better ageing. So the first point then, people aged 50 to 70 do not all have the same capabilities, opportunities and motivations. It's kind of fairly obvious. 50 to 70 is quite a wide age range, and you experience quite a lot of life changes, many of us during those sort of 20 years. So the implication of that is that the behaviour change interventions aimed at this group need to be targeted and granular. We've got to avoid making assumptions about things that older people need, and try and make sure that the support that we're offering is more tailored to the specific groups within that cohort. The second point is that while there are a range of health conditions which limit mobility, they don't all rule out active travel. So whilst a lot of people might be experiencing well, all sorts of different health conditions, as you can imagine, we need to make sure that the messaging is as inclusive as possible, so that people don't feel kind of excluded. Now, how that plays out in different contexts, if you like to take a fairly crude example, we talk about mammals, middle-aged men in lycra as one of the new terrors of the highway, but you know, that's one group of people who are engaging in active travel. If we assume that all cyclists are, or male cyclists perhaps, are of the mammal persuasion, then it suddenly becomes quite excluding, we think, to people maybe in the older age category. And we want to avoid those sorts of scenarios, although it's very easy for the tabloid media to present like that. We tend to try and avoid those sorts of scenarios to try and make people think about, to make people think that active travel is accessible to them, and to encourage them to think about how they can engage with that kind of activity. The third finding is about the key differentiating characteristic among the 50 to 70 year age group is between those still working and those retired. Now, again, it might feel fairly obvious. At some point during that 20-year period, most people retire, but it's really important life stage transition point, isn't it? So the policies that we implement should, to encourage active travel, should recognise these transitions and can address the need to prepare people who are still working for the changes in the behaviour that they might wish to make. So, I mean, what does that mean practically? That means practically, well, I'll talk about some of those things in the upcoming points on policy implications, but it's about making sure that whatever foundation we're setting down takes into account that people might be transitioning towards those that point of retirement, and all the differences in travel patterns, life patterns that entails, and how we can make sure that active travel remains or becomes at the forefront of people's minds in that sort of context. The fourth point on race, age, gender, socioeconomic status, the way they all intersect to influence how people in this age group perceive active travel. It's this thing about intersectionality and all the different groups, and it goes back to that first point about the granularity of intervention and making sure that interventions can be tailored. If they can be tailored, they can be targeted to specific groups. Again, I don't think this is any different to any other age group, if you like, in society in terms of that intersectionality. But there is a particular emphasis on it, it would appear, from the research that was done on this project, to try that really underscores the importance of targeted and granular interventions. The fifth point is that policymakers need to capitalise on the interest in walking for leisure among this age group to encourage the extension to walking of purposeful travel. What we know is that many people in the 50 to 70 age category enjoy going for a walk, and you know, we need to understand better the dynamic between that kind of walking for leisure, maybe walking the dog, maybe, you know, going out on a Sunday afternoon or whatever, and purposeful travel, and people being able to build it into their day-to-day travel habits and patterns. The sixth point is about changes in lifestyles and active travel habits brought about by lockdown. Now, this kind of dates the research a little bit. Maybe we did complete this study about 18 months ago now, but we think those elements of the pandemic, many of them haven't gone away, in the sense that people are increasingly aware of the benefits of being outdoors, of walking and active travel, cycling can offer, and you know, whether this is things like working at home for many people in this age group is still a thing, and how can we then make sure that people are supported to think again about active travel? The seventh policy implication: car-centric behaviours are usually formed much earlier than in midlife. We might reasonably argue that car-centric behaviours are underpinned by 50 years of planning that really emphasises the importance of the car. But again, in the context of what we can do in the here and now, the policies to target people at earlier stages in life are actually thinking about people before they get into midlife or older age, however you prefer to term it, and making sure that we're supporting people in developing active travel habits, more positive habits, more generally in terms of their behaviours before they get to midlife, as we might term it. The eighth point: even though cycling and walking are less intensive forms of exercise than some of those in midlife may have engaged with when they were younger, they nevertheless bring us major health benefits. There's something about, we talked to a lot of people in the study who had, I don't know, played a lot of football or done a lot of very vigorous forms of physical activity that are perhaps considered more demanding than walking and cycling might necessarily be. And I think there's that recognition that that sort of how we can support people to transition from those I don't know, contact sports or other forms of really very intensive forms of activity, how we can support that transition to walking and cycling, which are conventionally regarded as a bit less intensive, but they're nevertheless extremely important and can be done at fairly intensive levels, I think it's fair to say as well. The ninth point: there's a lack of understanding of the contribution of e-bikes and adapted cycles might make to a healthy lifestyle. E-bikes, I'm sure we're all familiar with e-bikes, and Chris mentioned them in terms of the studies that have informed his work. Adapted bikes is a really interesting area as well. I don't know how familiar people might be with them, but there's a whole range. There's an incredible range of bikes that are not the conventional two-wheeled, one handlebar type setup that are available for people to use, who've got all sorts of different mobility or sensory issues as well. So, you know, for example, you might talk about 3 or even 4-wheeler bikes that have got dual handlebars that somebody might be able to cycle somebody who's disabled alongside them on the bike. So the potential that adapted bikes offer is not well understood, and actually we've got bits of work going on at some strands at the moment to, on one hand, try and capture the whole range of what adapted bikes encompasses, but on the other hand, to think about what infrastructural needs there might be to enable the use of different types of bikes. So some really interesting developments on that front that could engage a far wider part of the community than is previously perhaps engaged in cycling. And the 10th point, the final part of these policy implications, is that the provision of good quality, adequately segregated and maintained cycle paths is the single biggest enabler of cycling in this age group, especially women this applies to, but across the board. And it's the same is true of other age groups as well. But we need to improve the walking and cycling infrastructure. It's a really important part of what we try and do. So I'm kind of getting to a point where we're wrapping up now, but I just wanted to give you some examples of how this stuff is playing out for Sustrans in the policy work that we do, how we're using this material. So the example on the left-hand side there is the Disabled Citizens Inquiry. This is a very recently completed piece of work that talks about how we can engage disabled citizens in active travel, how we can support them, and particularly how we can make sure that the work that we're doing to change places works for everybody. It works for people with a very wide range of different needs. The example in the middle is the age-friendly Tyburn report. It's a place in Birmingham where we're working particularly with older members of the community to try and make sure that the work that we're doing, the changes that we're making to the physical environment in Tyburn are kind of reflecting their needs. And then there's just a series of shots, screenshots on the right-hand side from blogs from the Sustrans website, which again just illustrate the kind of narrative that we're setting out, the kind of conversations that we want to have, particularly these examples in terms of better aging and older people. But there's an awful lot going on in the kind of the narrative that we and that other players in the active travel sector are doing at the moment. And then finally, stuff that's new and what's coming up. On the left-hand side, a report from the IPPR that we published in last autumn, I think, about fairly reducing car use in Scottish cities, and that's where it starts to map on to more explicitly to the climate crisis. It's all about a just transition for transport for people in low-income households, much of which includes older people, can include older people. So very Scottish in tone, but a really interesting piece of work that really starts to draw together the stuff about climate change and aging better. The thing in the middle is a very recent campaign that my colleagues in Scotland have run very recently, launched in March and is ongoing now, called the Give It a Go campaign, about trying to engage older people in thinking about active travel in the context of aging better. And the one on the right, a study which isn't published yet, which I meant to write on the slide, but it will be published sometime in the next few months, just thinking about aging in low traffic neighbourhoods. So just to illustrate really that we've got a lot of work going on in this space, and there's a lot of stuff in the pipeline, stuff going on now, and a lot of stuff in the pipeline that'll be coming up soon. So that's the end of my presentation. In the slide deck, there are a few links at the end of the presentation. So if they get shared after the talk, then do feel free to follow them up. But for now, thank you very much for listening.
Good, thank you very much, Andy. So as someone who's 71, I'm very pleased to hear about all that you're doing. We'll perhaps come back to this later, but Marty has put something about Wheels for Wellbeing, a disabled cyclist charity, with lots of links in the chat. We'll maybe come back to that later. Right now we're going to hear from Adrian Davis, who's been mentioned already and did a lot of the work that Andy was describing. So he's the Professor of Transport and Health, which is an excellent thing to be. I hope there are hundreds of you, Adrian.
There are two.
Right. At the Transport Research Institute at Edinburgh and Napier University, and a senior fellow at the University of West England and Bristol. He's an expert on road transport and health. He's devoted much of his energy to developing a better understanding as to the importance of health within transport planning and how this can be embedded in practice. And he's very interested in, it's written here, in order to accelerate behavior change away from habitualized motorized travel, which I see as getting people out of their cars. And he describes himself as a boundary spanner between research and practitioner worlds. So, and he's going to talk to us about barriers and facilitators for active travel to promote human and planetary health. To you, Adrian.
Thank you very much, Richard. So what I'm actually going to do is present on a report, which I hope you'll see on your screens now. Someone please say yes, you can see it. Hope you can.
Yes, we can.
Thank you. This is the report, as you can see, that I was involved in drafting last year on gathering the best available evidence on walking and cycling for WHO Europe. So I must mention my colleagues Francesca Rapiccioli from WHO Europe in Bonn office, who leads the Bonn office, and Thomas Gocci, formerly of University of Zurich, in pulling together this evidence, which I think one of the great advantages of coming third of three speakers is much has been said already that you need to know from Chris and Andy. So what you're going to hear from me is some repeats, which will allow me to go a little faster and give you more time for discussion, hopefully. So I'm just going to click down here, and I have to because it's a PDF rather than slides. Fiddle with it annoyingly a little bit to make it fit on the page. So the four main premises for this publication, excuse the spelling mistakes, this is someone else from WH Europe who put this together for us. So these are kind of obvious things, and again, coming third in the presentations. You've seen many versions of this, as it were, in the slides beforehand. So these are, however, are good times for advancing walking and cycling, despite what actually Andy had to refer to, the madness of what the government's been doing, cutting active travel budgets recently in England, which isn't the same elsewhere. It's not the same in Scotland, where things are forging ahead. So walking and cycling are central to urban mobility rather than afterthought. So we must make sure that that's where we are at. And the research, which we'll obviously come to, about the importance, and Richard really referred to this in the opening, that, you know, the nearest thing we've got to the magic bullet is is active travel, and of course walking and cycling are really important ways for us to achieve our 5 times 30 and much more. So if we can put in more vigorous to that, all the better. So I'll just go through the report in a sense, but all I'm doing here, I think the key thing for me in terms of takeaway is for you to go to the actual report, and there will be links available afterwards which take you there. So the key audience, thinking from a WHO mindset, who we're trying to get to, we're trying to get to the municipal authorities where we can, which don't necessarily easily find in WHO reports on their desk, certainly in transport departments, which is one of those kind of translational research challenges we have of getting to the people who we need to reach, who don't read peer-reviewed journals and are not necessarily scientifically trained in the way we are trained in public health and medicine in terms of evidence hierarchies and all that sort of stuff. So policymakers, practitioners, advocates, really important. There are very good examples from around the world of how advocates have really been able to push the narrative to get politicians ultimately, because transport is a political football, unfortunately. I'd say even more so in medicine and public health, which is hard enough in those professions, but in transport, the determinants of what happens is what the politicians really decide. So on we go. So what to expect? Well, so yes, it's a narrative review of the latest evidence. It does come across lots of stuff that Chris and Andy have talked about. There is a bias here in that much of the evidence is really urban related, and I think you could say you could have an appendices, a compendium document which does give a bit more focus, but that wasn't really part of the specific brief from WHO. Of course, many people do live in settlements of significant size, and that's the case. I'm speaking to you from Edinburgh, and majority of Scots live in settlements over 10,000 population. They don't live in hamlets of 500 people or something like that. Those are exceptions. So in terms of population health, it's not a bad thing to be focusing particularly on the urban environment. So you can see down here what we're setting out to do. Clearly, the scientific references at the bottom are important for us in terms of being able to be sure and have confidence in what we're talking about. So here, just as we've come out of COVID-19, and I'm going to come to this as well, we've seen that obviously some of the things we thought were set in stone are not set in stone, that things in terms of behavior change can happen quite quickly. Whether it needs the level of a pandemic to do that, of course, is a moot point, but nonetheless, things aren't quite so fixed as we thought they might be beforehand. Clearly, climate change, which is the focus of this discussion, is writ large. And again, sitting here from Edinburgh, the policy drivers in Scotland commence with decarbonisation in all sectors across the Scottish economy. Transport, obviously no exception to that. The biggest part of it in terms of emissions coming from the transport sector, still stubbornly the Achilles heel, perhaps, of all areas of public policy. electrification and e-bikes has been mentioned. Wider electrification, obviously we've got EV motor vehicles, but of course one of the challenges of that is one, the assumption that that's the answer when it's an easy behavior change, because people still end up driving a vehicle and haven't actually changed from driving a vehicle which is a ton in weight plus, and emissions are just coming from somewhere else. There are other technological advances which offer some hope for the future as well, but we should always remember the big challenge is it's about behavior change. We have to change our behaviors, and that's a hard thing to do. And people want to give up their cars, not a lot at all, as we found over the decades. So I'll just skip on further. You can read some of the other words as I go through. I've mentioned COVID-19 as a driver. Clearly it's important, and WHO, given its global reach, has been able to see a lot of the changes at a global level, let alone the European level. But even in the European level, that yes, travel behaviours patterns can change quickly. We've been able to do quite a lot of really important interventions across the UK with the funding that came during the pandemic to change behaviour. Now, some of that has stuck firm, and one of my favourites, a project I've been involved in monitoring and evaluation, is across the whole of Scottish Borders, which is a very rural area in southeast Scotland, where we were able to get, or the council, Scottish Borders Council, was able to get 20 miles an hour implemented in every settlement, virtually every settlement. That's about 100 settlements, and nearly all of those now have been made permanent. So that's a great opportunity now for improving population health, not least by less fatalities and all the rest of it, but hopefully in the future, maybe with some other interventions to add some synergetic effect, which might be a point of discussion later, to help people actively choose to walk or cycle. And that could be parents now choosing to walk and cycle their children along the village in Scottish Borders instead of driving them half a mile because it was too dangerous beforehand. There is always a question about, can changes be sustained, or whether we get regression to the mean after periods of time. I mean, it is an interesting and moot point that we found from international, but particularly high income country research, that behavior change towards active travel will not come immediately. Build it and they will come type of thing isn't necessarily the case. It takes time. We've seen evidence from the Cambridge guided busway, for example, of taking up to 2 years before we started to see significant and noticeable increases in walking alongside that corridor, which is essentially an active travel corridor alongside the guided busway. So these things do take time, just as car use, we think going back historically, those 50 years or whatever, took time to happen. It didn't happen overnight. So e-bikes, I don't need to say too much about them. My phrase for e-bikes is the rise of e-bikes, because we now see, I've stopped counting e-bikes because I look at every bike on the back and I see, well, is there a little motor in there somewhere? Is there a battery strapped on top of the rack or down the side of the tube, or etc.? And half the time there is, and I was sitting there counting them a little bit this morning. I'm a bit obsessive about counting. So e-bikes have definitely arrived. As more arrive, we will see hopefully a reduction in price, because there is an exclusivity about them in terms of cost. When you give people e-bikes, we found out in various trials, including the ones that Ashley Cooper was doing in Bristol on people with diabetes, they don't want to give the e-bikes back once they've had them a while. And we do find a lot of people in trials, certainly who can afford to, will buy an e-bike after they've had it, or at least, as Andy alluded to, they'll buy a bike because the e-bike has perhaps helped them to have confidence as much as anything, as well as increase their fitness. So this is a trend we see across high income countries, but it is also spreading further. So, and the other thing I suppose about e-bikes, just because it hasn't been mentioned before, is that people can travel further, and that's what we're finding with e-bikes. People have the confidence to travel further and more confidence to cycle in mixed traffic, because it's partly about the acceleration of e-bikes and getting into the traffic flow speed a bit easier and being able to sustain that even with a motor on slowly. Travel pattern trends, so I've alluded to this already, they're not set in stone. We can see that these things can change and have changed. There are various good examples now across Europe of where interventions have happened, and we've seen remarkable changes quite quickly in travel behaviour in a positive sense. I'll just mention, it's not on the slides, but Seville is a very good example if people aren't aware. A new mayor, supportive of active travel, came in about 2007 and said, I want you to build a cycling network. And I think the officers thought it was within perhaps 3 years, which I thought was undoable. It was not doable. And the mayor said, no, I want you to do it in a year. So he did some very rapid changes, and there was a significant percentage point uplift in cycling, even in a year, with doing small scale interventions to provide some protection for cyclists by putting in plastic bollards hard for cars to go over into cycle lanes and give cyclists some protection. So things can happen quite quickly, and we've got more of an evidence base than we've ever had before, and I'll return to that evidence base growing in a moment or in a bit. So as you go down the booklet, as I should call this document, why walking and cycling should be promoted, and I think for this group you don't need too much information about the whys. You know, it's part of the change from carbon-based transport to more calorific-based transport, and thinking about how we enable people and support people to do that because of all the various health benefits that come to it. I will discuss health benefits a tiny bit very quickly, and it's now. Do I need to say much about this? Richard kind of again pointed it out, but we do know from various studies, Copenhagen Heart study in 2000 was an important one, but if we go back to the work of Jerry Morris, Jerry pointed out, I think in 1994, that physical activity was the best buy in public health. And when we go into the detail, we find that actually in order to people to find time, as Andy was alluding to with some of his case studies, and I think Chris too, actually, it's part of the routine of daily living. It's habitualizing physical activity through walking and cycling, and getting people to be conscious about that and getting that habitualized early on in life, because again, as has been discussed, once people get into car culture and the normative set, and it is about, a lot of this is about social normalization, that once we lose people to car culture, it's hard to get them out again, and they can also act as barriers, vociferously, some of them, a minority of them, to changes away from something that they've almost become addicted to. Space efficiency, well, again, a bit of a no-brainer. You look at the size of that big square at the top, which is a space hoovered up by car use. That's a very generous 1.4 car occupancy. It's often 1.06 in the UK. Bicycles, when moving, quite a bit smaller. And obviously, when we get down to pedestrians, we're so space efficient. So that's really a no-brainer, but useful occasionally to point that out. The point here about the health benefits, I just want to really concentrate on the picture on the left. That's really about the dose response curve. So it's just to remind us, some of you perhaps in your registrar training or whatever will have gone through this, or if you might have done a master's in physical activity even. But the dose response curve, the word curve is, yes, there is a curve on it, but the first lower part of it is almost a straight line trajectory upwards. And that's because people who have low levels of physical activity get a disproportionately beneficial effect from doing that little bit more. Once you get up to the top of that curve and it starts to get a dotted line, that's where you're getting to the athlete stages, where you have to train and train and train 6 days a week for years to try and scrape off half a second to your best kind of 200-meter time or whatever it is. That's not really where population health is. We want to get really higher up on that curve for more of the population that have low levels of physical activity and therefore exposed to a higher risk of all-cause mortality, etc. So there are loads of good reasons on that image for why physical activity is the nearest thing to the magic bullet. And one at the bottom there, which is getting increasing attention, is helping to ameliorate the risk of dementia, which is obviously one of those issues we are thinking more about during the life course and the evidence for it. So Safety, well, there's a big issue about safety because it's the first thing, and perceived safety of pedestrians and cyclists. We do know that safety in numbers is a reality. It's not just a slogan, i.e. that the more people who are within a geographic area choosing to walk and cycle will likely have an effect on changing the behavior of the drivers, which is going to be more sympathetic and tolerant, largely, and that per risk per unit of exposure goes down. We need to be careful about that in terms of mustn't expose people and say, please go out and walk and cycle in environments which are still too hostile. But we do have a good evidence base now. The reverse of this, interestingly, is actually what Sandra Tintin in New Zealand pointed out, which is instead of safety in numbers is danger in scarcity. When you're the only one, when you're the last wildebeest out there, the lion's going to get you because you've got nowhere to hide from, kind of thing. And it's the same when we remove pedestrians, or particularly cyclists, from the road environment because most people are too scared to do it. There is that, a high risk element, particularly on faster roads, but even in towns and cities. Just a point on air pollution, because it's so continually important, it's just a slight point of reassurance, no, it's not a great one, is that even in our polluted transport environments in the UK and in much of Europe, the physical activity benefits of active travel still substantially outweigh any disbenefits. You have to go to some of the more polluted Indian cities, particularly Delhi and others, to be in environments where it is not advisable to do more physical activity than 30 minutes at maximum because of how toxic the air is. But that's not the case in Europe, thankfully, even though we've got a long way to go to improve air quality in the UK, and it does lead to premature mortality. One of the things that hasn't been mentioned yet, so I'm going to just flag it up, is the health economic assessment tool, which WHO, and Andy was involved in this, did probably 20 years ago now. It's been expanded, so it includes air quality as well as working out physical activity benefits. So you can do before and after studies of interventions. If you've got the data before and after of the numbers, you can show the health benefits in a cost-benefit analysis way from the tool. I would encourage people to go and look at that website, heatwalkingcycling.org. It's really can be really helpful. There are training sessions that people could go on to get more affay with how to use it, but it's a really useful tool. Research on walking and cycling, I alluded I was going to say this one. We will say on our QWERTY keyboards, more research is needed. That was mentioned earlier. We have an explosion in terms of research. I was one of the editors of the Journal of Transport and Health, which came into existence in 2013. I can't keep up with what that journal's publishing, let alone the probably hundreds of journals that could be publishing papers related to active travel across the world just in English. So there's a lot more evidence out there. It's not to say that we've got enough evidence in some areas, but we have a heck of a lot more evidence than we ever had before. As I'm coming towards a close, and I'm really aware of the time here, again, how walking and cycling can be promoted. Well, there's a list there, which you hopefully can, it's large enough size for you to see at least the headings. We do go through some of the important things, incentives and restrictions. So one of those you can see is decentivizing driving, traffic laws and regulations, safe systems and vision zeros, where we change the ethics to say we no longer accept it's okay for people to be killed and seriously injured in road traffic collisions. That supposedly is the zeitgeist of DFT and the other members of the UK countries. There are many other things, including urban planning, which obviously urban planning is really important. If I can't get from here to there by active travel because of the spatial differences, then we have problems. So we do go through all of this, and I'm just making you aware that we have done that. We do talk about this issue, a really important issue. If you're going to get people, particularly on bicycles, then you've got to have proper separation. We know that We need to lower speed limits to default to 20 miles an hour. So I'm working with the Welsh Government, for example. We've got Big Bang Day on the 17th of September. So please look towards that. I hope it's a great day, because on that day, Wales switches from 30 miles per hour default speed limits to 20. So that will become the norm, will be 20. When the street lights, it's 20. There will be a series of exceptions which local authorities, the 22 local authorities of Wales, can choose to put in, but the default will be 20. And we're seeing that more and more across the UK and across Europe. Spain has gone default 30 kph 2 years ago, and others are following suit as well. I don't really have time to go into this, and I don't want to. I'm sure Richard is itching for us to have some conversation. There are issues about network connectivity and quality. It's mentioned Seville, and I talked about Seville, so there's a bit of an example from there. But if you go and look at the document, you can look at this at your leisure. Similarly, traffic calming, which kind of relates to what I've just said about 20 miles an hour. We're now moving away from physical lumps and bumps to speed limits, but speed limits where we also do other things, hopefully, which is reallocation of road space and making the environment clearly perceivably safer for people to choose to travel actively. This last but one slide really segues back to what Chris was talking about, because he showed the Healthy Streets indicator. We have various tools that we can use to help to change and influence policies across sectors, and the Healthy Streets indicators and the tools there have been very useful, particularly not least, of course, in London, where Lucy Saunders introduced them. So in conclusion, a rich body of evidence that supports the claims that walking and cycling are beneficial for urban transport and well beyond. Their health benefits for active travel are substantial, and their potential to help move towards carbon-free mobility is increasingly recognised. I'm not going to read the other paragraph, it's too long. I will stop there, not least for time. So thank you very much for your attention.
Good. Well, thank you very much, Adrian. I wanted to cheer you up by saying how I heard Andy Haynes, who's probably the world's leading expert on health and climate change, say doctors should spend more time talking to ministers of transport than ministers of health, because actually they'll achieve more. Before I'm going to abuse the being the chair, just before I'll come to Artie, and then perhaps Katie would like to ask some questions. I'm sure that most people know that, walking and cycling is sort of good for you. My impression is that people don't know how good, just how powerful it is. I think, to be honest, that applies to a lot of health professionals as well. Does the evidence support that? And can we change that?
Yeah, so one of the things that's been a challenge, Richard, and you'll know this as a medic, and the other medics on here will know it as well, and maybe the younger ones can tell me otherwise, is the limited time period across your 5 years of training, 5-ish years of training, that people actually get to discuss the importance of physical activity. So, a friend of mine who's recently retired as a medic did half a day in the 1980s on physical activity. There was really nothing significant there, despite what you said at the introduction about the importance in terms of prevention of physical activity. So we really undersold it big time, and we need our colleagues in medical practice really to both understand it and to promote it in a way that we just haven't seen over the recent decades. I think and that does come probably from that lack of inclusion of it in a significant way into undergraduate training. Yeah.
And okay, let's go to Artie. And Artie, tell us who you are, please, and then ask your question.
Hi, hello, my name's Artie. I'm a GP in Sheffield. I also founded an organisation called Greener Practice, which is the UK's primary care sustainability network. So I'm really interested in how cities where they have, that you said infrastructure, and I think as somebody who cycles myself, that feels to me the most important thing. How have cities who've managed to create infrastructure actually managed to do this, and where should we be putting the efforts in our in our local authorities and local councils to transform this. And I specifically am, it's quite emotive for me at the moment, because a good friend of mine had his second crash in the space of a couple of years. We've got a WhatsApp group where, quite a lot of us are health professionals who are cycling, and the number of close passes that people are reporting, it actually has got to the point where my husband, who was a keen cyclist, has stopped cycling because he feels safer walking than cycling. I think infrastructure has got to be the most important thing that we do, but clearly people have done it, and I just wonder what we can learn from it.
Good. Adrian, would you like to go first? And then
I'll go first, but I'll partly give you, sadly, my daughter's just finishing at Sheffield University, and so one of the comments from a friend of mine was, don't let her cycle in Sheffield. I mean, Sheffield used to be buses city in the 1980s when we had David Blunkett's kind of rule, and car use ownership was suppressed because of high levels of bus use, and there are studies in the Journal of Community Health and Epidemiology which kind of reported on that years ago. So the issue, as you said, Artie, is infrastructure. It's not only infrastructure, it's a bag of things. And I want to quickly hand over to Andy and to Chris probably to carry on this. But we do know that if you look at the cycle, the best interventions to improve levels of walking and cycling, we were actually asked to do a study for this with South Transit, Andy and I combo again, a couple of years ago for Sport England. And what we found was the best interventions to improve walking and cycling, probably beyond things like road pricing, if you can get really big stuff in, but without those, will be a range of interventions that have a synergetic quality. So that means you put in your bus lanes all over the place, you put in your walking and cycling infrastructure in various ways, which, these days we talk about continuous side footways across side roads, so the pedestrians don't have to give way every sideway to motor vehicles. But the point being, put it in a whole range of interventions. I tend to say to students, you've got to throw the kitchen sink at it, all the tools that we know, which means you need significant amounts of funding. Now, during the Sustainable Travel Towns demonstration project between 2004 and 2009 in 3 cities in England, they actually did quite a lot of that work. And even after the funding finished, there was what we call a halo effect, and there were still more people choosing to walk and cycling. There was significant uplift, remembering, as Chris said, that public transport is an important intervention to increase physical activity through active travel. So I'd like to hand over to my colleague speakers to answer it more, please. Okay.
Chris, do you want to go next?
Yeah, I think what's really important is, you have to make the local case for it. And we've got a really good data set in London. We have the local travel demand survey that TfL runs. So we had a very, there was years of work to looking at that to make sure that there was a really strong case. And then, it's about influencing, upwards as well, and making sure that you get it locked down in policy. And then that, that's what we work to in London, or, in TfL. So having those targets embedded is really important to drive the work that, local authorities do. But then also, making sure that it's not just transport policy, it's cross-cutting, getting the public health teams on board, the local environment teams, and this affects all of us, so we need to kind of bring people along for the ride, as well as the NHS policy as well, which is rapidly developing, I would say. So things are going in the right direction, but there's definitely a lot more work that needs to be done to push it along.
Andy, do you want to add anything?
Just a little, yeah. I mean, it's quite a complicated dynamic, isn't it, between investment and the quality of provision and the who you're providing for, and making sure that what networks are being built are working for everybody. There's planning and land use and how that plays out in the context of different cities, such an important factor. And of course, traffic demand management as well, and making sure that that people have options for how they can move around. Just to pick out on the investment thing, I mean, we've got a very current crisis, if you like, in terms of investment in active travel, in that Department for Transport has reduced investment in active travel by £200 million over the coming next couple of years. But even notwithstanding that, for years and years, local authorities have been kind of encouraged to make good provision for cycling and good provision for walking as well. But it's that kind of, but it's always on a relatively short-term basis. So Adrian mentioned the Sustainable Travel Towns delivery pilots. There have been rounds of Cycle City Ambition program. There have been rounds of cycling demonstration towns, and they're all on a kind of a 3-year cycle, after which something else has happened that means that government's interested suddenly in a different thing, and the funding dries up. So whilst many of these towns got a sort of a putative sort of cycling network in place, or you know, the basic skeletal framework, it's much more difficult for the cities to transition to what you would regard as something like a full and complete network. So there are very particular examples where cities have invested, actually quite recently, in cycling superhighways that are really good for getting people from the suburbs to the city centres, commuting in there. Usually men, if we're honest about it, is a very sort of male pattern to be working in the city centre, rather than providing local area networks that people need to be able to move their families around and to be able to get to the shops, and therefore you've got this kind of gender imbalance in there as well. But you've got these kind of partial networks where some bits of it are really good and really suitable for a very tiny number of people to use for a very specific set of journeys, rather than a more comprehensive network that works for everybody.
Good, thanks, Andy. So Marty, let me come to you, and then Katie, I don't know whether you want to ask your question afterwards, or I'll ask it for you if you don't want to ask it yourself. Marty.
Yeah, sorry, I just meant to turn off. Yeah. Related to the as you said, Andy, the government had just cut, you know, kind of 200 million from the transport budget in the next few years. I was wondering if there's been a health economic analysis of, you know, what that could relates to in terms of increased NHS demand. You know, I see Labour's just done, I see in the Guardian an article that Labour said that could cost £2 billion over the long term. But obviously that's an analysis by the opposition party, but it'd be nice to have something that is from the health community, but and maybe not phrased that way, like you've just cost us this much, but a way of, well, you could save this much by putting this much into infrastructure.
Maybe that's a question for Chris.
Okay.
Do we know what the cost will be of cutting funding to active transport?
I don't, but I think it's, you know, a really good point. And you know, Adrian was talking about the heat tool earlier, and you know, using that as a, you know, a way of influencing people. You know, there are, you know, we can make these calculations, but and we need to be doing it. So, but yeah, I'd maybe defer to Adrian on that one.
It's a tough question, Adrian. Can you?
Well, I agree. It could be done. I suppose my cynicism at my age, Richard, is that the government doesn't care because it's doing it to a certain audience. So it's not a kind of throw in the towel type response, but it's like we can do it. We probably should do it. Wouldn't take that much to do it, but I think it's other things that are probably going to turn the tide, rather than just saying it's 2 billion, because they're not really interested in that. Sorry, that's just an honest answer.
Right, okay. I think unfortunately you're right.
Yeah.
So Katie, Marty, I think can you turn off, can you put yourself on mute again? Thanks. Katie, are you there? Do you want to ask your question?
I'm here. Thanks very much. I was just going to say, actually, just on a slight sidebar, Chris Whitty has been appointed to the board of the Active Travel England, which we think is a really interesting and good positive thing. So I work for the London Cycling Campaign. So I'm here because someone flagged this event today and I thought I'd come along. So thank you very much for doing this. It's really fascinating and also hugely encouraging. I just asked one of my first question, which is, Chris, earlier on you were talking about NHS groups supporting their local authorities. So really my question is about guidance for NHS health authorities in areas where the local council opposes active travel. You know, councils that regularly vote to not do anything at all for active travel, how those NHS bodies can actually work to lobby and engage and support campaigns that do actually try to change that.
Yeah, so it's a very difficult question, really. I think there is a lot more that can be done, though. I think particularly coming from the NHS angle, people you know, the local authorities will listen. You know, I think we need to escalate it through NHS as much as possible, and you know, having the NHS advocate for active travel would be really, you know, hopefully influential to the local authorities, and then, you know, looking at the policies in place again and, you know, using them as hooks where possible. But it, you know, it is challenging if, you know, local authority isn't favourable, but also, you know, why aren't they favourable? And, you know, is what you're suggesting what, you know, potentially what they need? You know, going back to the point, you know, they might not be keen for building lots of cycle infrastructure, but they might be really keen to build bus infrastructure. And, you know, so we can look at different ways of promoting active and sustainable travel, you know, depending on where the levers are. You know, that would be, you know, potentially my key thoughts on that, really.
Thank you.
Andy or Adrian, do you want to add anything? I mean, I'm rather horrified to think there are local authorities that positively oppose active travel. I couldn't imagine why anybody would do that.
No, apart from there are plenty of them, unfortunately.
What are their grounds for opposing it?
Well, it's usually a right-wing ideological slant of it's the freedom of the motorist. It's kind of what I call the Daily Mail kind of line of the war on the motor car, and they just use that as culture wars to stir up, and probably, particularly if there's an election coming, it's best to be a long way from an election point when you want to do an intervention. Actually, that's actually probably a useful thing. We discussed that in a meeting yesterday about 20 miles an hour rollout in Scotland. We haven't got any local elections for quite a long time, which is a good point to get on with it, because it won't be made use of like LTNs as kind of political fodder.
Yeah, I mean, I was horrified by what you said about transport was even more politicized than health. I found that hard to believe.
Well, the decision making, yeah.
Andy, do you want to add anything? I mean, Ruth here, we're going to finish in just a moment, but Ruth Galettley points out that there are these things now called integrated care boards, which is supposed to bring together all the different parts of the health system, social care, public, local authorities. It seems that would provide a lot of scope for doing something around this. I don't know whether Andy or Chris would like to say anything about that.
I don't know anything about integrated care boards really, and about how we can interact with them. But I mean, what I suppose partly in response to the previous point about the politicization, we've seen. I mean, just what I mentioned very early on, low traffic neighbourhoods, and the fact that suddenly they've become a really touch point for as a kind of a conspiracy theorist limitation of movement kind of argument, isn't it? Which is completely not whatever was intended by low traffic neighbourhoods or 20-minute neighbourhoods, or however you want to articulate. But it's a good representation of how polarised some of the discussions can get around some of these issues. Now, if we look to Wales, you've got some really interesting examples of the example that Adrian just gave, but plus the this move away from investment in roads is a really profound move that's being implemented in Wales. They're not going to build any new roads in Wales, which just feels such a really long way from what we're doing in England at the moment, and lines up with what you would assume is a sensible approach to wanting to reduce carbon emissions and what have you. But it's a complicated dynamic as to how you get there. There is that question of the extent of evidence available and how we play that in, and how we can use it to support the economic case making in transport, and trying to build health ever more pronouncedly into that sort of sphere of the work that we do. Sorry, that wasn't the question you asked at all, though. It was about integrated care boards. I'm really sorry, I don't know anything about those, but we'd welcome any support in trying to work out how we can interface with the organisations that can lever that sort of influence on local authorities.
Okay,
yeah,
thanks, Andy. So
on the ICBs,
just get Chris to say something, and then I think we'll have to finish then.
Are responsible for delivering green plans. So, it's about, if you're really passionate about this area, finding your local sustainability lead, speak to them. What are they doing on their active travel plans? Are they useful? Can you help them at all on what the local plans are? They should have them in place, making sure they are accountable for delivering those. And, that is one route that we can, go down to have impact.
Right, I'm sorry that there are other questions that we haven't answered, but I'm sure you could contact our speakers and they'll do their best to answer them. So I want to thank all of our speakers, and I want to end really by quoting again what Andy Haynes, Sir Andrew Haynes, who sat on the Intergovernmental Climate Panel on Climate Change. I mean, he points out that we as health professionals, we should be spending a lot more time talking to ministers of transport and people responsible for transport, because transport in the end has a huge impact on health, as we've just been discussing. And so Adrian is one of only 2 professors of transport and health, but I hope very soon there'll be 50 of you, Adrian. So thank you very much to everybody for contributing to this. I'm sorry we didn't get to answer all the questions, but send them to us and we'll send them to the people who've been speaking and try and get them answered. And all of this will be available as a webinar. So tell your health professional friends about it to help increase the understanding of just how important active transport is. Thank you very much, everybody. Thank you again to our speakers, and bye-bye.